This conference will now be recorded.
Okay, folks, so good morning and welcome to our first class for anatomy, physiology, and pathology class. Okay, we are going to be studying the human body throughout this whole semester. Myself and Dr. Massimo will be your lecturers, your professors, and you will learn a lot of information. You will need this information because you will go out into the workforce as far as working as a medical assistant, working with patients, and they are humans. And not to be goofy about it, but this is who we're studying. We're studying humans so that we can help them with whatever physical ailments and understand what's going on when we assist the doctors and the clinicians that we have, the physical PAs, physician's assistants, the nurse practitioners, whoever it is that we're assisting, that we have an understanding of what's going on and what's taking place with the patients that enter our offices, enter the facilities that we work at, what it is that they're suffering from, and also helps you to have an understanding regarding from the administrative point of view when you're processing billing, going to different companies and such, you have an understanding and reality of what it is that you're actually coding for these patients to for their billing to go out to these companies, or whether it's going to a law firm or an insurance company, whatever that may be. So the study of anatomy and physiology is the study of structure and function. And then the study of disease, pathology, really that's what it is. It's just the study of disease. So we see here that we're learning the parts of the body, how these parts function, how they work, the metabolism, the metabolic activities that are taking place, the biochemistry of the human body, how it does what it does, how does the brain function, how does the cardiovascular system, the respiratory system, the digestive system, a lot of complex functions there, folks. So physiology, the parts, the anatomy, the structure, not as difficult as really the study of how things function and how they work. It's a little bit more challenging. And then knowing what it's like for the human body in a healthy manner to be functioning, what's it like when it's not healthy, as the case of pathology. We're going to see over the next few slides regarding these reference systems. So you're going to see directional terms, planes, cavities, structural units. This is very important to, and some of you have already taken medical terminology. Some of you still need to take terminology, or you might be taking it this semester, coinciding with this class as far as the anatomy class. And it's really a good thing to have that terminology behind you to give you an understanding of how we label the parts of the body and how we determine what's going on as far as diagnosing different pathologies and illnesses. So these terms of direction are very important for you to know, right? So knowing something is superior or inferior, something is anterior, the front, or posterior in the back, or cephalad towards the head, right, or cranial. These are all terms you have to, we have a lot of, you'll see where it says or, there are a lot of AKAs, also known as, okay? That's just a part of the medical profession and medical terminology, the language that we speak. So you are, if you haven't taken medical terminology yet, you're at a little bit of a disadvantage that you're going to have to learn that while you're learning anatomy and physiology and pathology. Okay, so you'll see here that we're going to look at an image in just one moment here. There we go. And I'll come back to this slide in just a moment. So you'll see here as far as superior, inferior. So the head is superior to the feet are inferior to the head, right? Simple enough. Let's go back for a moment here. So or actually, let me show you here. This also anterior and posterior. Now, there's also an AK, also known as ventral and dorsal. How do we get that? How do we figure that out? Well, think of a shark and think of the dorsal fin on a shark. Where would you see that? You know, that the dorsal fin, it's on the back, is it not? Well, the posterior aspect of the body would be considered the dorsal area. The anterior aspect would be considered the ventral. So anterior, aka ventral, posterior, aka dorsal. Okay, go back up for a moment here. So we have here superior and inferior, anterior and posterior, cephalad, cranial, going towards the head, medial, lateral, proximal, distal. Okay, so when we're thinking of the midline of the body, right down the midline of the body, Medial would be closer to the midline. Lateral would be further away from the midline. Proximal and distal have to deal with nearness, right? So let's look here. So we would say that, right? So we're looking at the hands here. The hand is distal to the shoulder or to the head. The shoulder is proximal to the head. Okay, proximal distal. Okay, so that's how you need to know these different terms and understand, when we're charting, when we're putting in progress notes into the computer system, into the digital program that we have, we are using these terms to describe where a patient might be experiencing pain and discomfort, or have an injury, or have some type of lesion. Okay, so they're descriptive terms. Now, the planes of the body, these are important because, again, too, we'll be seeing, you might inadvertently see, but the clinicians will actually have tests ordered, like an MRI, like a CAT scan, like a PET scan, that these will have slices, so to speak, of the body that we're able to digitally manipulate the body so that we can see and look for tumors, disease processes, any type of lesions there. We'll be looking in the different planes of the body and be able to see sections of the body. And it's fascinating, folks, quite interesting, and really important to be able to know. So these planes, right? Let's look at the mid-sagittal and sagittal. So when we look at this, so here we would say, see this blue right here, mid-sagittal, so because it's going right down the midline, you would even see it go up right between the nose and such if it were taken up higher. This blue area right here, so the blue, that would separate the body if it's mid-sagittal into a right half and a left half. Okay? If it were sagittal, say it was over here in this area right here, and the blue, we would move it over here, we would have a right portion and a left portion. The right portion would be greater than the left portion if that plane were right here, separating body into a right area and a left area. They're unequal, but mid-sagittal, it's down the midline of the body, so it would separate the body into a half, into two halves. So mid-sagittal divides the body through the midline into two equal left and right portions. Now the sagittal, it's not necessarily mid-sagittal. So any plane parallel to the mid-sagittal, so it's parallel to that. So it divides the body into unequal right and left portions. Okay. Horizontal, aka also known as the transverse plane. Frontal, aka also known as the coronal plane. So let's take a look at these. So you'll see here, so here we would have the frontal, aka coronal plane. It's in pink, right here, over here. And it's separating the body into a anterior portion and a posterior portion. That's this frontal, aka coronal plane. The transverse, right here, aka horizontal plane, is right here, separates the body into a superior and inferior portions. And if this were on an angle, it would be the oblique plane. Okay, so the oblique plane. So let me come back here until, oh, nope, I'm gonna exit out here for a moment. So you can write this down. Transverse plane and angle. Okay. So you're not viewing it there in that image, but you'll see that. I'll show it to you. And let's go to. Okay. So here you're looking at oblique planes. That's just giving you an idea. There's an angle, not parallel or a right angle. That's good. Well, let's see if this will play. Okay, guess not. All right, well, let's move on. Cavities of the body. Okay, so the cavities of the body, and I'm going to step away for just one moment and turn on my overhead fan. Give me one moment. Okay, all right. So sorry about that. So we have these cavities, these dorsal, aka posterior, ventral, aka anterior cavities, and we're going to look at an image here and see that this dorsal cavity would contain the brain and the spinal cord. Okay, the dorsal cavity. The ventral cavity would contain the thoracic, abdominal, pelvic cavities. Okay, and so with these, you're looking at the thoracic cavity containing the lungs as well as the great vessels in the heart. Okay? The ventral cavity would also contain this abdominal pelvic region. So we have many organs as far as the stomach, the liver, the intestines and such, large and small. So this would be contained, here we go, in this abdominal pelvic, as well as the sexual reproductive organs, okay, the reproductive organs. So you're looking at ventral and dorsal cavity. The parietal and visceral coverings, right? So when we think of, there are coverings of all the organs of the body. I apologize, I'm just getting a little warm here. So when we're thinking of the organs of the body, they're covered in different membranes, okay? Coverings, okay? So the visceral membrane would actually have direct contact with, excuse me, one moment, I'm gonna. So the visceral coverings would be actually covering the viscera. So when we think of an organ of the body, we talk about the viscera, okay? So the visceral covering would be direct contact with the organ. The parietal covering would be outside of, on top of the visceral covering, all right? So this would have direct contact with whatever is in the cavity, and there's going to be a space between that. There'll be a liquid, okay? And this liquid will allow for movement of the organ without producing any type of heat. Do this for me, please. So have your hands and move them like this together. What occurs, folks, is that you'll feel heat, right? There's friction that builds up. We don't want that to take place when we have our organs of our body moving. So in particular, think of your lungs, your heart, right? A lot of movements taking place there throughout each day, 24 hours a day, 24/7. And so we don't want friction to build up, so we don't want heat to build up so that we could actually cause damage to the tissues of the body. Think about this for a moment. When a person has a temperature, a high internal body temperature, um, could that cause damage to the organs of the body? In particular, we're thinking of the brain. So if we're having a temperature above, 103, 104, and we start getting high like that, we could actually cause brain damage because of too much heat in the body. And so we need to cool the body down quickly, and safely. So, okay, so the cell would be considered the smallest structural unit of life. Okay, the cell. I'm sure in different schooling throughout the years, you all have had some type of um, experience with learning a little bit about the cell. Well, know that the body has organs, right? And these bodies, the human body has organs present. We've talked about them, and these organs are made up of tissues. These are different types of specialized structures that will actually maintain, like, so think of muscle. Muscle is a tissue. Cartilage is a tissue, okay? Fat is a tissue. Well, these tissues are made up of cells, specific types of cells, having a specific function for the tissue that they're involved in order to allow for an organ to do its job, its function, okay? So cells perform all these activities to maintain life. So you'll see here as far as metabolic activity. So these would be the different types of chemical uh, operations. So metabolism, you're thinking maintaining of different levels of certain chemicals throughout the body to allow for, in the case of a cell, how about production of, say, ATP? ATP is a special type of energy that's produced in the body that allows for things to happen. So in the case of ATP, it allows for muscles to do their work. ATP is very important. It's produced by the mitochondria, these little miniature organs, we would call them organelles, of the cell. Okay, so these are all the products, the activities that the cells will do in order to maintain life. So tissues are made up of cells, right? And so the tissues, they're made up of different types of cells. There are, now you need to know these different specific types. There are 4 basic types of tissues, okay? Epithelial, connective, muscle or muscular, and nervous tissue, okay? The epithelial tissue covers and lines, we'd say protects. Connective tissue binds and supports. Muscle allows for movement, and nervous tissue, really it's connecting the input that we receive via these sensory structures to then go send information out to motor structures, so to have muscles do their job. That's an example of what nervous tissue, it's controlling the brain, the spinal cord, controlling the muscular system to do what you would like it to do, particular specific type of muscle. So we have here, so epithelial tissue, you think of your skin, okay, important. Think of the coverings of your organs, epithelial tissue. The connective tissue, think of bones, think of fat, adipose tissue, think of cartilage, adipose tissue, think of blood. It's a fluid type of a connective tissue, binds and supports other tissues. The bones, like I said, a muscle, we have muscle that we can control. It's called skeletal muscle, right? We can do movements. I can think about it and I can do, right? I can cause contraction and movement. Or how about like cardiac muscle, which is not voluntarily control over. This cardiac muscle, the muscle that allows for your heart to beat, right? Do, 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 do. That would be, cardiac muscle. How about smooth muscle? This is the 3rd type of muscle, and this is a muscle that you don't have conscious control over. It's present within all the organs of your body, and it's controlled by the brain, but you're not controlling it yourself, okay? And then the nervous tissue, we made mention of that already. So the organs are made up of tissues, which are made up of cells, right? So cells integrated into tissues, and these different types of cells and tissues, right, come together to form this organ to have a common function, okay? So you're thinking of the liver, the stomach, and there's all types of organs that you'll be learning about this semester. And a system is a group of organs. So we can have an organ system, a body system that comprises these different types of organs, right? So now what we're going to do right now is we're going to look at the different body systems. So here we have first the integumentary system. Now this is the skin as well as the accessory structures that are working with the skin, okay? So skin, hair, nails, sweat glands, sebaceous glands. Folks, you will need to know all of these different body systems, know the organs that are present, and need to know the functions of these different body systems. Right from the very get-go, right from the first chapter here, we want you to learn this so that this way, as we go through chapter by chapter and we cover each of these organ systems, you will be prepared to know what you need to know as far as for this class and for taking your board exam and such, okay? Skeletal system, dealing with the bones, dealing with cartilage, so the soft tissue. The cartilage is what really allows for the bones not to rub directly on bone, right? There's cartilage covering the ends of bones and also allowing for cushioning, say in the spine, as far as the vertebral discs, the intervertebral discs, or how about the menisci of the meniscus, medial and lateral of the knee. So very important structures. How about the fact that you can open your mouth, right, and close it, right? You're moving your jaw, your mandible, okay? And it's called the temporomandibular joint, the TMJ. That also has a special type of cartilage that takes a lot of wear and tear. And so you'll see here we talked about the skin, the integumentary system with its accessory structures. We talked about the bones and how they are involved in protection. involved in storage. So fat and mineral storage, what does that mean? Well, calcium is a major ion and mineral that is present, and the minerals that are present also within are important for not only just your bones to stay strong and healthy, but also for your nervous system and your muscular system to move and to function. So very important, folks. So also you'll see here as far as blood production. So in the marrow, which would be inside of the bone. So you'll be learning about this, but there's red and yellow marrow. The red marrow, the red bone marrow, is important for blood cell production. Okay, and we'll talk about that in more detail in the skeletal system. The muscular system, I mentioned to you about the 3 different types of muscles, and know that there are other accessory structures attached to and facilitating the function of the muscles as far as different coverings and sheaths and bursa and structures that will aid in the free movement of the muscles so that there's no impingement and that they're able to do their job. The nervous system, really the brain and the spinal cord, that's what you think of when you think of the nervous system. But there's also different types of nerves that are connected, that are coming directly off of the brain, cranial nerves, the peripheral nerves, going all to the areas of the body, allowing for us to be able to have control over. Know that if someone has some type of damage to the nervous system, excuse me, to the cervical region, you could affect the ability to move the upper and lower extremities. If someone has damage to severed the spinal cord, say in the thoracic region or the lumbar region, this can affect their ability to function of their and ambulate, to walk of their lower extremities. So the nervous system is key, crucial to the control over all the functions of the body. And it'll work in conjunction with the endocrine system. The endocrine system produces chemicals that will be released in the blood and sent to different areas of the body in order to make some type of change. Okay? When you think of hormones, you might think of estrogen, testosterone. These are feminizing and masculinizing hormones, respectively, as well as, say, how about thyroid hormone? Many people unfortunately have issues with that and maybe have too little or too low. They would be hypothyroid. When we think of thyroid hormone, we think of it's really it's a metabolic hormone. We say it's a major metabolic hormone that if you have too high levels, your whole body system will be revved up and elevated. So you'll have higher blood pressure and have other issues where exophthalmos, where your eyes will kind of bulge a bit. Not good for your heart rate, not good for your overall, your body's running too fast. That would be hyperthyroid. You have too much thyroid hormones circulating and stimulating the body. Or hypothyroid, where you have too low levels of thyroid hormone, can affect also, and there can be lethargy, fatigue, tiredness, and the body's functions are just kind of in slow motion. The cardiovascular system. This is a system where we have the heart and the blood vessels and the blood circulating throughout the body, sending oxygen, nutrients to the body tissues, to the cells and the tissues of the body, and removing waste products, removing CO2, carbon dioxide, and sending it out of the body, right? Via the interaction between the cardiovascular system and the respiratory system. So the lymphatic system works in conjunction with the cardiovascular system in providing an immune function to the body. So when we say the immune system, we would say it's a functional system. The lymphatic and the cardiovascular system are body systems. They're true body systems. The immune system, again, it's a functional system that's comprised of the lymphatic as well as the cardiovascular system. Because in the cardiovascular system, we have white blood cells that work in conjunction with the lymphatic system in order to provide an immune response for the human body. Okay. Respiratory system, I mentioned this before, and so the receiving of oxygen, the removal of CO2, and allowing then for oxygenation to take place in the blood, and then sent via the cardiovascular system to all the tissues of the body. Digestive system involved in taking in nutrients, right? We take in animal and plant proteins, carbohydrates, lipids, fats, right? And we're able to convert them to human proteins, fats, carbohydrates, right? And create our own cells, which will aid in the replenishment and the replacement of damaged tissues. And know that over time. So say that the bone, it's very hard, right? But it's living tissue, right? It's living tissue, and so the bone will be broken down and built back up. We would say it's called remodeling um, on a regular basis. It takes place very slow, but it takes place, and so we have tissues of our body that are replaced and repaired, except for in the nervous system, the brain, spinal cord. These areas of the body, those cells, those nerve cells, those neurons do not get replaced, except for your sense of smell, olfaction. But primarily, that's not. So when you have brain damage, when you have a severing of the cord, like I said to you there, damage to the cord, it's not being repaired, and you are left with an illness that could be debilitating and very can be catastrophic. The urinary system, so just the digestive system will take solid waste out of our body. The urinary system will take liquid waste out of our body and remove and involved in chemical regulation. And really know that the urinary system is filtering blood and we're producing urine. It's a filtrate first, and eventually it'll become urine as it's leaving the body. And know that really you're filtering vast amount of blood, but you're only producing and eliminating only a very like 1% of all that's been filtered. The rest is being reabsorbed back into the body. And finally, the reproductive system, so that we can help to maintain our species, right, and reproduce after our own kind. Now, this term homeostasis deals with creating a stable environment within the body, maintaining that no matter what goes on outside of the body. So the human body, right, needs to maintain levels of sodium ions, potassium ions, blood glucose levels, your heart rate at a certain rate, your respiratory rate, your breathing rate, your blood pressure, right, your temperature. These are just some variables that I would mention to you all that need to be maintained at certain levels, okay, in order for you to be healthy. So homeostasis, right, the maintenance of the body's internal environment, right? There's a range. So if we say that 98.6 Fahrenheit would be the set point, would be the number that we would say for a healthy body temperature, core body temperature. Now know that really as time has gone on, that was given back in 1860s, that temperature number. Now we're lower. We're in the 97.5 and above, really, not so much the 98.6 as far as body temperature. But we're going to use that because we still use that term, that number, 98.6 degrees Fahrenheit. Okay, so there's a little bit of a range of a point or two above, a point or two below. That range is healthy. Now, if it goes too high, so we're at 99, we're at 100. If you've been to a facility and they've checked your temperature, and if it's 100 or above, they're not allowing you access into the building, even if it's just something other than it's an infection or you're dealing with something that's causing you to have a raise in temperature, other than the virus, or it could be the virus that's causing that temperature, the coronavirus. So, temperature is a big deal now. So if it goes too high, or if your temperature is too low, if you're outside in the cold and you're not having anything gear to keep you warm, right? You're unprotected out in the cold, could your body temperature, core temperature reduce? Whatever that may be, the body will use what's called negative feedback loop in order to bring the temperature down to that set point, to that range that it needs to be, or if it's too cold, it'll bring it back up to that set point, that 98.6 Fahrenheit, that range a little bit above, a little bit below, that's healthy. Negative feedback always brings it back to the level where it needs to be in order for you to be healthy. So whether it's glucose levels, whether it's your body temperature, whether it's your blood pressure, your heart rate, your respiratory rate, your sodium ion concentration, your potassium ion concentration, whatever it may be, folks, whatever variable it is, it will bring it back to where it needs to be for a healthy level. So in the case of blood glucose levels, right? So levels will rise dramatically, blood glucose after a meal, right? This is important. The cells will, as a result of using insulin, will be able to maintain, use, make adequate use of blood glucose and use that nutrient, as well as if we have too much, then the excess will be stored as what's called glycogen. It'll be stored in the liver, it'll be stored in the skeletal muscle, and that's important so that so when we're not eating, because we're not eating 24/7, right? There'll be times that we're not eating. We need to maintain healthy levels of blood glucose. So thus, glucose levels remain nearly constant because between meals, we'll have this other hormone, glucagon, that'll be released by the pancreas, that'll break down the glycogen that's been stored into glucose and return it to the blood. So there's always, whether we're eating or not, there's always these blood glucose levels are maintained at a certain little small range, okay? And this is as a result of negative feedback. Okay, the body temperature. The hypothalamus would be considered the thermostat. I'm looking at my thermostat now in my room here. And so realizing that we have a thermostat in our body, in the brain, located very deep within the brain, called the hypothalamus, that will allow for whether if the temperature is too high, it'll bring it down, or if it's too low, it'll bring it back up by mechanism. So if it's too high, right? So if the hypothalamus or your thermostat detects increase in body temp, it'll cause sweating, it'll cause vasodilation or blood vessels to dilate. And what that means is that those blood vessels will expand, have more blood flowing through them, in particular on the surface of the skin. So you'll look kind of red, right? You'll look red because what's happening is that the vasodilation is bringing more blood to the skin so that it can release the heat present within the blood. Does that make sense to you? And so the sweating will also allow for this sweat to go on the surface of the skin and evaporate and cool the body down. So that's a negative feedback loop, and that's healthy. Okay, so negative feedback always brings the variable, no matter what it is, whether it's temperature, whether it's blood pressure, whether it's blood glucose levels, whatever it is, it brings it back to the healthy set point, the range where it should be in. Okay. So the body monitors for deviations in homeostasis, and so it's continually tweaking. Right, the nervous system will work in conjunction with the body systems to determine, hey, do I need to increase or decrease something in order to maintain it at the proper level that it needs to be. So negative feedback loop, responses that revise disturbances to the body's condition and return it to normal. Positive feedback really means that it will go away from the set point, so away from the 98.6 Fahrenheit. So positive feedback really, it's not healthy other than in two cases, in uterine contractions and also for the cessation of bleeding. Okay, if you have a damage to a blood vessel and you're bleeding, whether it's internally or externally, the body will do all that it can to send platelets. These are little tiny pieces of cells to that area to block the opening, the cut within the blood vessel, and over time, eventually lead to bringing more what'll happen is that these platelets will send out chemicals from the damaged site, and then they'll attract more platelets. And then those platelets and all the other platelets there will send out chemicals, attracting more platelets to the area. So we're continually adding more and more platelets, increasing the number of platelets to the area in order to allow for the stoppage of that cut and prevent the bleeding that's taking place. Okay? So positive feedback, the birth of a child, the stoppage of bleeding, those are all positive feedback mechanisms that are healthy. Okay? See here, as far as the organ systems help control internal environment, yes. So all the organ systems and the organs of the body are working in conjunction with the brain in order to maintain homeostasis. Okay? And so you can review this part of it just as far as the summary is concerned, but we've discussed all of this information for today. I'm going to stop recording